Hello, I'm here today to talk about skin picking. Do you find yourself picking at your skin a lot more often than you want to? Perhaps finding that your hand is already starting to pick at something, but then you can't stop it even once you caught yourself doing it? It may be what we call excoriation, or simply skin picking. My name is Chris Basten, a clinical psychologist in Sydney. Now, a lot of people pick at their skin and it might not be a problem, but you might think it's a problem if you pick at your skin in response to negative emotions a lot. And the most common ones are often frustration, stress, and boredom. Or if you do it habitually and you cannot resist the urge to scratch and pick. Or you might think it's a problem if you can't stop it even when you're troubled by scabs and scarring and bleeding. Now, there's a few things that we know about excoriation or skin picking, and I'll share them with you now. Now, it's very similar to trichotillomania, or more commonly hair pulling. And many people with trick will also pick at their skin in a compulsive way a lot more than they want to. Excoriation or skin picking is also associated with obsessive compulsive anxiety and personality traits. Habitual skin pickers usually use their fingernails or their hands, but they might also use tweezers. People find that their hand just seeks out lumps and flakiness, anything that they feel like is a blemish. And the more the person picks, the more scars they have, in a vicious cycle of seeking and picking and going back over it. A lot of people find that it leads to short-term relief and a real reduction in tension, but in the long term people feel unhappy with it and sad that they can't control it. Now, if you're wondering what you can do to help yourself, there are a few things that we know from studies. The first thing that everybody suggests is that you start to keep track of it, keep a record, preferably a written one, of when you get the urge to pick, how intense the urge is, and which situations or emotions occur just before that urge. Cognitive behaviour therapy, or CBT, seems to work well according to the treatment outcome studies. CBT is a well-known treatment, and when it is tailored to skin picking, it usually relies very heavily on a process of what is called habit reversal. So you might want to go around seeking a psychologist who's trained in that particular type of skill. It pays to rehearse, and then you can use one particular go-to strategy every time you get an urge to pick. Some people might use patting the skin or doing something else with their fingers, and so that becomes your new habit. It's more complex than that, and you may wish to see a psychologist to deepen that particular technique. You might also want to learn how to get out of the itch-scratch cycle if that applies to you. We can recommend that you keep your nails short, put sticking plaster on them if you have to, keep any sores really clean because you don't want to get them infected, and please just be patient, keep trying. These habits are really compulsive and quite ingrained. They can be reversed, but you just have to persist. Now, if you'd like to know more about OCD, trichotillomania, excoriation, or other related conditions, you can contact me or my colleagues at www.bastenpsychology.com.au. Look after yourselves and the people close to you.